Introduction, Greg. I am a geek, so I'm not that used to talking to so many people in a room unless, of course, it's online, but we'll see how we go. My presentation today is really quite vast, and as such, it's really going to be very much a whirlwind tour of some of the things that not only Moreland Hall's doing, but a number of agencies across the world. So what I'm going to be talking about today is social networking, and I think the first thing to take into account is that social networking is not new. Social networking is something that we've been doing well and truly before the invention of the internet. If you think about the social groups that you were in 10, 15 years ago, we just communicated with our social groups differently. I guess some of the point that I'll be talking about today is about how social networking's changed that and what kinds of opportunities it opens up for us in the sector. So how can we use social networks to advance work in the AOD sector? I'm going to be talking about 3 points. The first being advocacy, the second being education, and particularly with an emphasis on lifelong learning, and lastly around how we can use social networks and social media for service delivery. So advocacy is something that the AOD sector has been doing for a long time. It's something that's incredibly important when we consider the people that we work with. The people that we work with are stigmatised and marginalised, and unfortunately traditional media quite often reinforces that. If we think about the broadcast news and print media and the way that they portray the people that we work with, quite often that does our clients a disservice. I guess one of the things that social networks and social media enables us to do is it's put the means of production for media in the hands of people like you and me. What's that mean? Well, it means that we can mobilise people, that we can reach a larger audience. It should be said that social media has quite often been attributed as a causative factor for movements. Things like the Arab Spring and Occupy everywhere. I think that's a far stretch. But what I can say about it is that it's enabled us to globalise movements. Local movements have become global. A really good example of this is some media reporting by the Irish Independent, I think it was last year, that was highly stigmatising of people who use drugs. The response to that news article came not just from advocates in Ireland, but right across the world. So much so that the writer of that piece was complaining about the fact that he was getting hate mail from right across the world. Hate mail might be a little bit strong. People standing up for the rights of people who are marginalised was probably a better description. What's it mean for you and me? It means that a person with nothing more than a laptop and an internet connection can actually be an advocate for the causes that we're passionate about. Doesn't mean, however, just making ad breaks for our organisation, a constant stream of look at us, look at what we're doing. It means making social connection with people. A really good example of this is Overdose Awareness Day. Most people in the room would be aware of Overdose Awareness Day. It's become an international event. There was a couple of people on Twitter in 2010 that said, hey, why don't we just attach a hashtag, a shared hashtag on Twitter to all the tweets related to Overdose Awareness Day in 2010. And what that meant was that people within Twitter could follow that hashtag, much as people can follow the hashtag for today's seminar, and get a stream of different people's thoughts around Overdose Prevention Day. That started last year. Moreland Hall took part in that, and we took part again in it this year. Last year we didn't have any measurement about how far that reached, but Nigel Brunston, who will be teleconferencing into the panel later today, actually recorded metrics for this year's campaign. Nigel kindly made that data, preliminary data, available to me. He'll be releasing it soon on the internet, I think in the next couple of months. But I was able to examine that data and have a look at the impact that Moreland Hall's tweets on that day had and how many people it reached. And the interesting thing was Moreland Hall's Twitter account at that time had about 160 followers. And the reach that we made there wasn't much beyond those 160 followers. What that says to me is that it's not the content that's necessarily important, though it still is. It's more about the connection. That our advocacy online is very much premised in the connections that we make. Second thing that I want to talk about is education. And I think I have a real passion for lifelong learning. I think formal learning is really important. However, with the kind of moving goalposts that we have in the AOD sector, and Lawrence mentioned this before, we're in a sector that is subject to a lot of change. You know? New drugs come on the scene, new drug trends, new drug treatments, constantly coming on the scene. How do we keep abreast of that in a timely manner? Formal education only gets us so far. So as a sector, we need to be committed to lifelong learning. Now I want you to think for a minute about the teams that you work in. Teams share information with each other. I know that I'll be sitting at my desk and somebody comes across an article or something that they think is relevant or important to the work I do. They'll send me an email, or they might send an email to the whole team. A lot of our learning is premised on our personal learning networks. If we think about our personal learning networks, it'll be made up of our supervisors, our colleagues, maybe other people that we've worked with in the past, mentors, and indeed service users. Imagine what would happen if that email, rather than going to the 4, 5, 10 people in your team, went out to 100 people, 150 people, 200 people. That's the power of social networks. That's the power of things like Twitter. I didn't have a Twitter account until a year ago, and I have to say that in the last 12 months, my learning has grown exponentially, just through contacting people, learning from others. There are a number of vehicles that we can utilise for this, including a number of specialist vehicles. I know that Greg Logan, who's emceeing today, was one of the initiators of the Dual Diagnosis Support Victoria NING site, a social network for people to share resources and information with each other and just have conversations about their work. It was that work that inspired Moreland Hall to start a similar site for harm reduction in alcohol and other drug workers called Heads Together. Again, it's a NING site. It has more than 700 members. It's had over 10,000 visits, nearly 1,500 unique visitors from 24 different countries. It has more than 20 special interest groups and more than 200 links to AOD-related videos and other resources. What have we learnt? We've been operating this for 2.5 years now. What we've learnt is that there's a lot of lurkers. There's not a lot of people in that community that are prepared to talk. But that doesn't mean that it's not of benefit to a greater number of people. So we only have a small number of overt contributors over time. However, the impact of that is difficult to measure because people may be learning while not speaking. The last section that I want to talk about is service delivery. And in terms of service delivery, I think it's important that the AOD sector make a shift to online. And the reason for this is that the AOD sector and harm reduction sectors have had a tradition of meeting people where they're at. We meet them in venues where they might take drugs, we meet them out in the streets, and we meet them where they're at motivationally. Once upon a time, that was the local marketplace. And it still is, and I think that work's incredibly important. But what we also know is that people are sharing their lives online, that they're spending more and more time online. According to the Pew Research Centre, 52 million American adults, or 55% of those who have internet access, have used the web to get health or medical information. 26% have looked for mental health information. And 80% of health seekers say it's important to them that they get this information anonymously, without having to talk to anyone. 16% said that they had used the web to get information about a sensitive health topic. And we could imagine that for a number of people, their AOD use is a sensitive issue. Moreland Hall's made a number of forays into this area, including the Bluebelly website. The Bluebelly website was developed to address drug-related harms associated with psychostimulant use. It was innovative in terms of that the harm reduction articles were actually wikis, that the users of the sites themselves could actually contribute to the information that was disseminated to people. The Bluebelly initiative combined a website, film production, and also integrated popular social networks like Twitter and Facebook. What we learnt from this process is that again, we had a number of lurkers but not a lot of contributors. And there's a number of theses, hypotheses about that, including the fact that people might want to share information about their drug use, or it might be just that people are lurkers by nature. What was more interesting was that in some ways, the Twitter and Facebook accounts attached to Bluebelly actually probably had more traction with our target audience than the actual site did. The last thing that I want to talk about is the future, where to from here. I think that the globalisation of advocacy will continue, that local issues will be taken up at a global level. I think that the integration of popular social networks with formal learning will become a reality, where we will start doing formal online learning, but it will also be combined with, hey, look what I've learned. Let's post it to Facebook, let's post it to Twitter. Or, where am I going to go and seek my information? Lastly, I just want to talk about the future of service delivery. And I think there'll be two great moves in service delivery in the next few years. The first one will be around video conferencing, which is already being used quite successfully in a number of medical areas, and I think that we will be moving towards that in the future in the AOD sector. Lastly, mobile access. Mobile access to internet will soon, they reckon probably in the next 12 months, outstrip desktop access to the internet. This provides us with a great opportunity to provide timely, opportunistic and geolocated information to people as they need it. But we really need to think about how are we going to do that. With that, I'll open up for questions. Thank you.